Hi, and welcome back to the Clinician Spotlight. My name is Tony Maritato. I'm a licensed physical therapist, and today joining me on the show is Lyda, the owner and speech language pathologist from Instrumental Speech Language Pathology Group. Now, Lyda is out in the Anaheim, California area, and she's going to be talking to us today about her business. So Lyda, thank you so much for joining me today. I would love to hear more about your practice because one of the things that I realized was you're doing more telehealth services. And I think a lot of potential patients really don't know what telehealth would be, how that works. So first, before we get into any of that, can you tell me about yourself? What got you into speech language pathology in the first place?
Yeah, thanks for asking and thanks for having me on. I actually went to a speech language pathologist when I was little. So I couldn't say my R's when I was little, probably like, 5, 6, 7, 8. And I grew up in Mississippi. I was born in California, grew up in Mississippi, and the transition was really, really hard for me, except when I went to go see my speech language pathologist. And that was just such a positive, amazing experience in an otherwise really hard time. And so I went through life. I never considered being a speech therapist until one day it hit me, and I was like, that's what I need to do. That's my career. I felt very strongly about it very quickly. And the doors just opened up. And part of that, driver is always wanting to help people. That's always been kind of like a core of my personality, is being very helpful. And so when I was considering that career, I was like, oh, this is kind of perfect. I'll be able to help people, and I think I'll be good at it. And so ever since then, I've just been on that path, and it's been great.
Now you're out in Anaheim, California. Can you tell me a little bit about your practice? What made you decide to go into practice for yourself? And then what kind of services are you guys offering?
Yeah, so we offer speech and language therapy in person in the office and also by teletherapy. And we specialize in aphasia, apraxia, and swallowing disorders for adults. So there's a lot of practices out there that do a lot of work with kids. We have a couple speech therapists that do a little work on the side with kids, but our primary focus is for adults. So when I was going to school for speech therapy, I did my internship with kids. They were fabulous, loved them. And then I did my internship with adults, and I was like, this is who I love working with. It's just so fascinating, and it's so rewarding working with the adult population.
And you
Yes, go
mentioned
ahead.
some clinical terms there that I would love for you to just define a little bit, because I think we hear these terms and the people that are going to be watching this video might not know what aphasia is or any of things. So what are some of the main problems that people are coming to you with in just plain language?
Yeah, so what will happen is sometimes people will have a stroke or a brain injury, and that can affect areas in the brain that affect your ability to produce speech, to plan what your mouth does for speech, and that's called apraxia, and your ability to actually use language and understand language, and that's called aphasia. And there's a lot of kind of other components that can be involved as far as your ability to pay attention, your ability to remember, and your thinking skills. So when you come to see us, it's our job to really untease all of that and figure out, what's going to make the biggest difference for you the quickest. And so we get in there, we do all of our assessments, and then we create a treatment plan based on what you want to achieve.
And so often I see, we have family members that might have a major neurologic event. They get into the
Mhm.
hospital system. Of course, they get physical therapy, occupational therapy, speech language, but then they get discharged. All of that
Mhm.
kind of wraps up. Now, what you're doing is you're helping those individuals that have kind of moved maybe even beyond some of that. Could you talk a little bit about somebody who might have had an event months ago or even
Mhm.
years ago, but they're still having some deficits? Can they reach out to you directly? How does that process work?
Yes, that's a great question. So when I started my career, I wanted to make sure I got as much experience in as many settings as possible to figure out the continuum of care. So when you first get sick, you go to the hospital and you don't really know what's the next step. So that's kind of where I come in. You can always call me and I can advise you on, what is the next step? Is your loved one or yourself in a hospital? Well, you have two options. You can go home with home health, or, you can go to a skilled nursing facility. So that's more like in the acute phases. So shortly after you have some sort of stroke or brain injury. So I would love to see you when you're done with the hospital at the outpatient level. So that's after the hospital, after home health, after skilled nursing. That's the level of support that we provide. Also, we don't just provide therapy to people who have just had a stroke or brain injury. We love working with people who have a more chronic issue. So long-standing aphasia or apraxia. You can definitely continue to make improvement. I don't care what anybody says. If you put in the work, you're going to continue to see improvement. So if it's been over 6 months, if it's been 4 years, we're working with somebody who's been 4 years post-stroke, and they're making amazing progress. And teletherapy, we have found, is for most people just as good as in-person therapy. So we love providing teletherapy.
Now, I would love to hear more about teletherapy specifically, because I know we hear so much resistance in individuals that are saying that, well, the geriatric population, my mom and dad, they don't know how to use the device. They don't know how to get on. But what is the normal situation for you if a patient has a need for therapy, wants to bring you on? I've got family members that absolutely could benefit from a service like this. Do they do it on their phone? Do they do it on a computer? Like, what's the technology set up?
Yeah, that's a great question. So I don't recommend doing it on the phone unless absolutely necessary, just because the screen's so small. And
Right.
the way that we work the teletherapy is we do a lot of screen sharing. So the basic requirements are you should probably have a tablet or a laptop computer, and you just have to be able to see the screen and hear us. So if you have low vision, if you are very hard of hearing, teletherapy might not be the format for you.
Right. I've
Other than
had
that,
some,
it's, yeah,
sorry, go ahead.
I was just going to say, other than that, it's fair game.
I will say I've had some patients that have adult children that are incredibly tech savvy. And so
Yes.
they've cast the phone to the TV so my patient could see a big screen. I
Yeah.
mean, sometimes a 50-inch screen. And so, it's just incredible, the technology
Wow.
that's already in the home that we don't even think
Yes.
of connecting. And so
That's amazing. I'm going to steal that. Thank you,
it is.
Tony. That's
It was
great.
really, really helpful. Now, obviously, you are a participating Medicare provider, so these
Yes.
services could be covered by Medicare Part B. But if the patient maybe doesn't have medical necessity, but still seeks to improve their skills of communication, they could also, you do provide some self-pay services?
Yes, absolutely. So we love working with clients, Medicare, that we are enrolled with Medicare, and whenever possible, that's who we send the bill to. There are situations beyond that when we provide services that are over and above what Medicare will cover. And in that case, yes, absolutely. We love to work with people who want to do the work, regardless of whether Medicare will pay. Also, we do an intensive comprehensive aphasia program, and we can tailor it to apraxia too. So that just means it's like 3 or 4 hours of therapy every day, 4 days a week for 3 or 4 weeks. So it's not for the faint of heart. It's really, really intense, but people see really amazing improvements with it. So we love providing that service.
And who would be a good candidate for something like that?
So we recommend not doing any or not providing this to anybody who's pretty close to the actual stroke or brain injury, just because more is not necessarily better in the first few months. However, if you're, 2 or 3 months down the line and you feel physically ready, you can tolerate the whole duration and still benefit from it. So you're not yawning by the third or fourth hour, then that would be like kind of the perfect candidate.
Okay, now, before I ask how people can get a hold of you, I know the
Yes.
question that's been on everybody's mind. How do
Mhm.
you say your last name?
It's really not that bad. It's Kongswangwongsa. So I married into that name, and it's Thai in origin.
Oh, wow. Okay,
Yeah.
wonderful. So what is the best way for anybody watching this who believes that either they themselves or the family member would benefit from the kind of services that you deliver? How can they get in touch with you?
Yes, absolutely. So they can go to my website, www.islppro.com, and there's contact forms on there. So you can fill out the contact form and I will email you back and call you as well. You
And
can find my phone number there. I'm sorry, go ahead.
I was just going to say, and with you offering telehealth, I imagine that it's available to anybody in the state of California.
Yes, it is. And beyond that, we're also licensed in Washington State. So we can provide services in both.
That's amazing. All right. I want to be mindful of your time. Thank you so much for coming on and sharing information about your business.
Thank you for having me, Tony. It was great talking to you.
All right. I'll talk to you soon.
Okay, have a good day. Bye, everyone.